if you are one of the many people out there living with a connective tissue disorder, whether that is joint hypermobility or Ehlers-Danlos syndrome or one of the many other connective tissue disorders that exist, you might be wondering, why is it that my joints can be so loose but my muscles can be so tight? The thing with connective tissue disorders is that it is an issue within the ligaments that causes joint instability, and it's that ligamentous laxity that creates too much movement within a joint. Now, the brain is very, very clever, and the first thing that it will do when it is unable to stabilise a joint the way that it should do ordinarily is that it will start to look for other things that it can do to encourage stability within a joint. What that tends to mean is that it recruits the muscles to provide stability. So the muscles enter what is called a hypertonic state, which means that they are basically constantly switched on. This can mean that you might experience widespread muscle tension, widespread muscle pain, and this constant feeling of tension throughout the whole of your body. Now, when a muscle is in a hypertonic state, it is already contracted. So that muscle length has already contracted and shortened. And what will then happen is that the muscle is unable to contract further because it's already contracted. There's nowhere else for it to go. So that in itself is going to cause problems. It's also going to mean that the muscle becomes what's called functionally weak. Because it's constantly contracted, it's no longer able to perform its function the way that it should. So now you've got ligaments that are unstable, and you've also got muscles that are unable to support the joint as well. So over time, that causes pain and that causes problems. The other thing that we tend to see is in a muscle that isn't contracting and relaxing the way that an ordinary muscle would, we aren't getting that normal flow of removal of waste products, influx of blood and nice nutrients into the muscle. And so that can cause a build-up of waste products within the muscle, leading to inflammation and, you guessed it, pain. For many people with connective tissue disorders and for somebody living with constant pain and constant tension in their muscles, you might be thinking that actually what you need to do is work on those muscles in order to get some form of relief. Now, that can be true for some people, but for the vast majority of people, actually doing intensive muscle work is going to cause more problems than it fixes. The fact is, the brain is using the muscles to provide stability to a joint. If we then start to introduce, perhaps as part of a treatment plan or perhaps as something that you've been doing at home, if we start to introduce things like foam rollering or dry needling or soft tissue work or massage, we're taking away the only stability that your brain has for that joint. So we remove the only stability that the brain is getting from that joint. So it's going to cause more problems because the brain wants stability and the joint needs stability. What we have to do instead is work to provide relief to the muscles whilst also encouraging stability within the joints. We tend to do that here through a range of techniques. So we use things like dynamic neuromuscular stabilization to encourage your joints to become what's called centrated. So sit properly within their anatomical position that helps to encourage our body to stabilize the area fully. It can help to re-educate the ligaments, to re-educate the muscles, and to re-educate you in terms of how you use and move your body. And that in itself is a much better and much more effective approach to provide long-term relief of symptoms than simply doing muscle work or doing massage, which might provide a temporary relief, but is ultimately only going to cause further problems down the line. I hope that was useful. Do check out the rest of our videos and don't forget to hit subscribe so you can stay tuned for more from us.